The newest arrival is 18-year-old Dalton. He's struggling to breathe.
Right, Dalton, we're going to get you moved over onto this other bed, all right? Do you think you'd be all right shuffling over for us?
His girlfriend Amy often helps when he's having these terrifying attacks. Nurse Jade Boothroyd takes the handover.
So yesterday he was at water ballet and had an asthma attack. Came on out of nowhere, nothing particular sort of triggers it. He went to hospital, they did back-to-back nebs on him and he didn't really show any great signs of improvement. They wanted to keep him in hospital, but he wanted to go home. And then tonight, it's just sort of hit him again and can deteriorate quite quickly.
Dalton is vulnerable to these sudden, dramatic asthma outbreaks, so he's rushed to resus, where he can be monitored for early signs of danger. In resus is 18-year-old Dalton with his girlfriend Amy.
I'll hand over to you once you've...
He suffers from brittle asthma, which means he's at risk from sudden, life-threatening attacks at any time. Dalton's symptoms often get worse at night, when he's less mobile. Junior Dr. Tobias Hill has just begun his late shift.
My name's Ross, I'm the doctor's here. When did your breathing get bad? Worse. Yeah.
I can tell you, his breathing dropped about 20 to 11.
And son, you've been in hospital with asthma before?
Yeah.
Yeah. How many times?
In my life?
Yeah. Quite a lot.
Yeah.
When was the most recent time?
Yesterday.
How often do you use your flu inhaler?
Every day.
Every day. Is that a couple of times a day or just once or twice?
Mostly at night.
Yeah. And today, how many times do you use it?
You've already gone through an inhaler today. Yeah.
Okay, so forward for me.
Do you want me to move out the way? Just for 2 seconds.
Dr. Hill is giving Dalton nebs, medicines which are pumped straight into his lungs to clear his airways. The shortage of oxygen is causing problems throughout his body.
Do you have any pain anywhere?
Back on my shoulders. Any cramp.
Yeah.
So it's hard. I struggle to bend my fingers.
As I just today.
Yeah.
I think with your breathing going off, you get that kind of odd sensation to your hands and toes.
If the medication doesn't work, Dalton may need a ventilator to help him breathe. Dalton is in resus after a severe asthma attack. Dr. Hill has put him on a nebulizer to get more oxygen into his system. A blood test will show if this is working.
You can be a bit more painful than the ones from the vein. We need this to be faster than your blood.
Gas samples, used to measure oxygen levels in the blood, have to be taken from deep-lying arteries.
Try going again. The minute that neb finishes, you struggle.
In resus, after a severe asthma attack, is 18-year-old Dalton with his girlfriend Amy.
Hi, is it Dalton? Hiya, I'm Nicole. Just want to do an X-ray of your chest, alright? X-ray. And breathe.
Dalton is on nebs, medicine pumped straight into his lungs to clear his airways. Dr. Hill tests whether the drugs are getting his breathing back to a safe rate.
Some treatment things like so you're going up to 60. So carry on with the next.
His rate should be about 500, so Dalton is still at risk.
I'm just going to take it off a moment. Get you some more. I'll get you another set of.
Your gas was slightly worse than the one we did earlier. So we're going to talk to our critical care team to get them to come and see you. Okay.
If his medication doesn't start working soon, Dalton may need to go to intensive care. In resus is 18-year-old Dalton, who came in after a severe asthma attack.
Just going to put these up your top, okay?
He's been medicated for more than 3 hours, but the oxygen levels in his blood are still dropping.
Watch this first, eh?
Casualty have called in consultant Dr. Peter Claydon from the intensive care unit.
Is this the worst asthma attack you've had? No. No, you've had some bad ones, have you? Have you been in hospital, admitted to hospital with them before?
Yeah.
Yeah. Have you been unwell in the last few days?
Had a bit of a cold and flu and that. But
Right. Okay. When did you get into ED?
I was in last night, but not here. And then I thought I was better, so I discharged myself, and then obviously not. So back in now.
Yeah. Okay.
Good blanket.
Dalton's girlfriend Amy has been keeping a close eye on him.
Might just need to check your blood gas again. Have you been a bit better during the day?
Yeah.
But worse again tonight. Yeah.
It's a nervous wait for the new blood results.
I discharged myself, but
No.
So that blood gas is very similar to the one that we did about midnight-ish. And it's certainly a bit better than the one that looked like it was getting a bit worse. So at the minute, you don't need to come to critical care bed. We certainly need to keep you here in the hospital and keep a close eye on everything.
Dalton spent the rest of the day under supervision on the general ward. He was monitored on the short stay unit and went home 3 days later. He lives with the threat of the next attack and a lifetime of hospital visits. 74-year-old Val has come in after an attack of breathlessness.
I've been trying to chat him up.
It's just a shame we have to wear all these masks. She's missing out on how handsome I am. Right, Val?
You ready?
Thing like that.
Way! Oh, I haven't had a slide like that for ages.
Val has been off colour for 3 days, but has just taken a turn for the worse.
Daughter's come round today and found her in the bedroom, was sat in a chair. New onset of confusion, shortness of breath, very unwell. Goes to call an ambulance. Right, Valerie? They'll look after you from here, all right?
Well, thank you very much.
Very welcome. You take care, lass.
I will do.
See ya.
You can take me out one day.
Auxiliary Wendy arrives to insert a cannula.
It is, darling.
Are you okay to take some blood from you?
Yeah,
Brilliant.
definitely. I'll just call you Dracula, yeah?
How you do? Sharp scratch coming up. You're doing really well there.
I'm a lover. You are. It's red hot in here, isn't it?
It is warm, yeah, definitely. All done and dusted. Look at
Oh, don't look at that.
perfect.
Oh.
Val is given some medication to help open up her airways.
So, we've got some steroids for you.
Okay.
Yeah.
I hope I'm not going to grow a beard.
Hopefully not.
Oh, I've been shocking.
Have you?
Yeah, it's been absolutely murder.
Right, so we need to take this mask down,
Okay.
obviously. And then this one just goes round the back of your head.
All right,
I'll
sweetheart.
just tighten it up a little bit for you.
Yeah,
Is that all right?
that's lovely.
Yeah. There we are.
That's lovely, thank you. Causing some trouble, aren't I?
You feel all right?
But I've just had a heart attack. I'll have had another bloody heart attack by the time I get this over with.
It's been warm as well, hasn't it, which
Yeah.
probably doesn't help.
Sorry, Bob. Very frightening.
The heat wave is aggravating Val's breathing difficulties, and it's also affecting the staff. In cubicle 2, great-grandmother Val has been put on a nebulizer after a shocking bout of breathlessness.
Sorry, I'll be blowing up like a puppet.
Dr. Sarah Brown will be looking after her today.
Right then, so how's that chest feeling since we put this on?
I'm very tired. I'm drained. But I feel better than what I did when I came in. I thought, oh, I've never known an experience like this.
Has it just been your breathing that's been a bother?
Yes,
Yeah. Other
Yeah.
than that, you've been all right for these past few days?
I'm not been so bad now.
Okay.
But I've been a bit frightened because I've had a heart attack.
Yeah.
And I was thinking, I hope I'm not going to have another
You let us worry about that bit. Have you had any pain in your chest at all?
in the summer.
In your tummy? All right, let me have a feel then.
Yes.
It's a little bit, still a bit sore, isn't it? Yeah, you look like you're flinching a bit.
Yeah. And this weather I've been out
Yeah, it makes you feel really hot, doesn't it?
It's very warm in here.
It is, you're right, I know.
I've got a right dab on.
Sorry.
A dab. Sweating. Barnsley talk.
I'll open that curtain again in a second. Hopefully that should make it a little bit of airflow in here for you.
Thank you for being nice.
You're very welcome. All right. See you in
Okay,
a bit.
sweetheart. Bye-bye.
Val is going to have to hang on in the casualty heat until her blood results come through.
I think it's finished. Oh no, I've drunk it all. I'm as high as a kite.
She had a series of tests to find out what had caused her problems.
Oh, that's nice.
Dr. Brown has now got Val's results.
Right, Valerie, your blood tests have come back and it looks like you've got quite a nasty infection. Your kidneys are struggling a bit and I think
Yeah.
that's probably because you've had quite so much fluid come out of you.
Yeah.
Yeah,
Yeah.
and with this infection going on. So we're going to get you up to the ward and then they'll carry on your fluids and your antibiotics
lovely.
upstairs.
Okay.
And if you need any more nebulizers, they can give you those as well.
All right.
Although it sounds as though your chest is feeling a bit easier now.
Yeah.
Does it feel easier to you?
Yeah.
There you go. So I bet I don't want to leave those here, do you?
Thank you.
All right, no problem.
Thank you
Take
very
care.
And you too, love. Thank you.
Val stayed overnight and is now back home and feeling much better. 2-year-old Seb has been rushed in with his mum Cassie.
I know, buddy. Do you want to wear it? Would that be easier?
Dr. Lamar immediately gives him a nebulizer to aid his breathing.
You're getting a little bit frightened, or if a child looks really poorly, nebulizers are what we go to first. That's really good. I know. As they walked in with Seb, you could see that he was just the wrong colour. You know, he looked a little bit more grey than a normal kid did. He was properly slumped and sort of clinging to mum. As soon as he walked through ED, you could tell that kid wasn't right. So nice big deep breaths, and that'll get the medicine where it needs to go.
Seb's lungs are working harder than they should to get oxygen into his body.
There's a point at which he'll get tired, and he'll struggle to breathe against that very resistant chest. And as he gets tired, he'll just breathe less and less. And what you're worried about then is, rather than a wheezy chest, is a silent chest. So if the wheeze stops, you're in trouble. Perfect. Just like that. Should we move it around your ears a little bit?
2-year-old Seb is still fighting hard to get oxygen into his body.
We'll try a couple more of those nebulizers, but I think he's needing so many of them, he's going to need a little bit more of a look at for a slightly longer time we're going to manage here. Worst case scenario for Seb is that he gets tired, and at some point he just wouldn't keep up with it, and that's the point of respiratory arrest. There's something really wrong with his breathing.
In paediatric casualty, 2-year-old Seb's shallow breathing is still causing concern.
Medicine. A little bit of medicine for me. Is that okay? Oh, such a good boy. We're ready. Nice and wide, all in one. You done? Oh, done. Good boy.
Oh, it's a good cough there, Seb.
Yeah.
And look, your
I like them
breathing
numbers a bit
still looks a
better
bit
as well.
hard. Can you see what we're looking at,
Yeah.
Mom? So he's sucking in a little bit there.
Yeah.
Seb, can you
This
tip
one
your
with
chin
your
up
arm.
a little bit?
Good boy.
Dr. Lamar is yet to see an improvement in Seb's condition.
In kids, the breathing can be the problem that's causing everything to go horribly wrong. If adults get really unwell and have a cardiac arrest, it tends to be heart-related. With children, it tends to be a breathing problem that causes their heart to stop. So, because you've got a bit of a cough and you're struggling with your breathing, we're going to give you some more of that magic medicine. So it'll help your breathing. It was just because he looks so poorly that he's getting numerous nebulizers to make sure he doesn't deteriorate.
Despite the team's best efforts, Seb is still struggling to breathe.
He's still wheezy at the minute, so chances are we'll need to do another one of those after. And I think we might just be back-to-backing them for a while.
In paediatric casualty, 2-year-old Seb has been struggling to breathe for over 10 hours.
This will make you feel lots better. Wowzers, what a superstar. You ready?
Sister Naomi and Dr. Lamar have been giving him a series of nebulizers to open up his lungs.
You've got to bear in mind that it's the single most terrifying day that kid's ever experienced. That'll be the first time he'll have come into ED that he can remember. So it's anything to try and settle him down. Do you want to see a trick?
Yes, please.
Do you want to see a trick?
Where did it go?
Where's it gone?
Wow.
Vanish. Do you know where it's gone? It's just appeared back there. I used to be able to put it in people's ears, but now that's a bit... It's no go anymore, is it?
Paediatric Registrar Dr. Fiona Blythe has come to assess Seb.
You will need to come up to the children's ward, and I've already told them about him, okay? Good boy. And what we'll do is we'll continue that medicine that he started on, but we'll give him a bit more time between the doses now, okay? His chest sounds better than what I believe it was earlier.
Finally, there are signs that the medicine is beginning to work.
How do you think he's doing, Mum, since when he first came in?
He seems happier and, well, not happier, but you know, more settled than he was at home, definitely.
That's brilliant. There's no wheeze there at all now, and his air entry is much better throughout. So the medicine has done its trick, hasn't it? Very good. But he will need to continue on it, okay, which is what we're going to do. We'll get him up to the ward and he'll have another nebulizer as soon as he gets up there, okay?
Do you want me to sit on my special trolley with you and we'll go for a ride? We go there together. Yeah. Oh, and then we're going to go for a big ride.
Seb's breathing difficulties were the result of a viral infection. He was kept in overnight and discharged the following day. He's now home and back to his chatty self.
Adele, come there for you. Come on then, in that way.
Hello, Barnsley Emergency Department. Yep, go for it. 8 years old, struggling breathing.
The ambulance is moments away. Nurse Kate is assigned the patient.
I'm just going to have to go to resus. There's an 8-year-old breathing difficulties coming in.
Earlier this year, Riley had surgery to his lung because air was escaping into his chest cavity.
Hiya!
And there's concern he has the condition again.
Hello! Hello. Are you Riley then? My name's Kate. We'll just get you all set up and the doctor's going to come and have a look at you. Is that okay?
That cough last night, the alarm, because that's how it all started.
Last time.
The latest patient in resus is 8-year-old Riley. He's previously suffered a condition called a pneumothorax, which led to a collapsed lung. And there's concern it's happened again.
Is this your mum? Yeah? Are you not talking to me?
Tired, aren't you?
I think assessing how you're going to approach each patient comes with experience of different children, different behaviours. So we had the pneumothorax in March, did we say?
December we found
December.
And they operated January. And they did say it were all clear.
Right, I see. You can sometimes get a sense of whether that little boy's going to want to talk to you or whether he just wants his mum, and it just all comes with experience and spending time with the children to work out what works for what.
Consultant Dr. Chris Young has come to assess him.
Riley, hi Riley. Hi. How are you doing? You a bit short of breath? Are you your thumb up anyway? Are you mum?
If air gets into the space between a chest wall and the lung, the pressure can cause the lung to collapse.
Just pop that forward for me. Again, so I can listen to your back. There we go.
Because Riley's lung has collapsed before, he's more at risk of it happening again.
The wheeze certainly is a little bit quieter on the left-hand side than it is on the right-hand side. So we'll get him out of that crate and see what's what.
Alright, thank you. Hello, it's only Kate round in resus. Can you have a shuffle round and clear HDU so that I can bring Riley into that bay? Alright, thank you, bye. Oh, I'll have to make you a bit lower, I can't see to drive.
Riley is sent for a chest x-ray to assess the condition of his lungs.
I'm not a very good driver.
In radiology, Riley has just had his chest x-ray.
Thank you. Right, we're going somewhere different now.
While he waits for the results, he's transferred to the high dependency unit in the paediatric ward. His dad has arrived and has found him an essential item.
Oh, have you got your Nintendo? Sorted. Still waiting for the internet connection. Oh, he must be feeling relaxed now because he's chatting. This is taking a while. Is it taking forever? Yeah. Right, I'll get your paperwork finished and I'll come back in a minute and check your numbers. Okay.
In the hub, Dr. Young is assessing Riley's x-ray. The images show a partial collapse to his lung.
So we've sent the images over to the Children's Hospital. The surgical team there are going to have a look at those and compare them to the previous ones.
Can it be the infection that has caused it?
So, I think the question is we don't really know what exactly has caused it.
It's been fine since this weekend.
When the surgeons call back, they'll we'll have another chat with them and let them know what's going on. I just have to give them a call now and see if we'll get things going a bit quicker.
In the paediatric high dependency cubicle, Nurse Kate is monitoring Riley's progress.
I might get you some Calpol because you're a bit warm, is that okay? You'll be fine, it'll go back down, don't worry.
How are you doing, mate? You okay? Right, so I've got back in touch with the surgical team in Sheffield. They're happy that we should send you over to them to have another look and see what's going on. Compared to what it was the first time round when it was a big whopping thing, okay, so it's much smaller than this time, nevertheless. Probably needs someone just to have a bit of a look at it. We'll get an ambulance arranged and we'll get you over to them. Alright. Okay. So you're off to Sheffield again, mate?
Good job with wearing pyjamas.
Yeah. Hiya, can I have an ambulance please for Barnsley A&E to Sheffield Children's please? Yeah, they want a blue light transfer. Thanks, bye.
After you guys.
Right, we'll see you later. Don't be pretending you're quiet again now. Bye. Bye, we'll see you later. Bye. Bye, Riley.
Riley was transferred to Sheffield Children's Hospital. He was sent home without the need for surgery. A 64-year-old man is being rushed into resus. Dr. Guinness is preparing to treat him. The hot weather has caused Melvin to have severe breathing difficulties.
I had worked in Barnsley as a junior doctor quite a few times during my training, and then when it came to picking a consultant job, it was a bit of a no-brainer really. It was the only place I wanted to come and work. We're in a very privileged position to meet people at the most vulnerable.
Right then, Melvin, just while you're having your blood test taken, I understand, so you suffer with your chest quite badly at home. Are you on oxygen normally at home?
Yes.
How much do you have at home normally?
Machine's on number 2.
All the time?
Yes.
Day and night?
Yes.
And then I'm gathering that things just got worse today, gradually?
Yeah, I've just had enough, yeah.
Okay. Do you smoke?
I'm knackered, I didn't sleep a wink last night. Okay. So now, I'm just knackered.
Fair enough. Do you smoke?
No, I've stopped.
When did you quit?
Last time I came in hospital, day before.
Okay, a few months back. Well done.
Worst thing anybody can do is start smoking.
Yes, COPD is a chronic lung disease, and people can find it really difficult to breathe sometimes when it flares up. It can be horribly scary, I think, that feeling where you just can't get your breath in and often can't get your breath out.
Oh.
Yeah, it's a really horrible condition to have, and people live with it for their lives. It's a lifelong condition once you've got it.
I'll swap you onto this nebulizer.
Melvin is being given medication to open up his lungs, which should ease his breathing.
Okay, it's going to go a bit misty now.
Yeah.
When that's gone through, I'm going to put you onto a different oxygen mask so that we can control very carefully the amount of oxygen that you're getting, okay?
Right.
So that's on there.
Melvin loves to chat, and that's quite difficult when you're breathless. I know he's been very worried about his dog. He's left his dog behind. I think he's got the neighbour to sort that out. And that's generally really stressful, I think, when you're having to come into hospital and leaving someone that depends on you behind. So I can understand that.
Yes, I weren't going to come in unless I got her to agree to look after the dog. Because last time I went in hospital, I'm going to stick it out for another day. And I told staff when I got in, and they said if I had it done, I might have died. So when I get here, I just let them do it up, just get on with it. Yeah, they're great nurses. I love all the lot of them.
Your oxygen levels at the moment are doing okay, but you're needing a lot of oxygen to keep them at that level.
It's lungs, they're kaput.
And you're going to be stopping in with us in hospital for a day or two at least, I should think.
Last time they said that it was 2 weeks.
Hope it won't be that long this time. Okay, let me go and arrange those things for you. We'll get this treatment sorted and we'll see how you go, okay?
Super.
In Melvin's case, he could have come and seen us a little bit sooner, I reckon. I think many Barnsley folk think they're going to waste our time if they come into A&E with something, and they tend to leave it a little bit too late, or later than we would like.
So does Barnsley tap water taste nicer than any other water?
Just about, yes. You can't beat Barnsley tap water.
It's cold, that one, isn't it?
3 hours after being admitted into resus, 64-year-old Melvin is still receiving treatment to get his breathing under control. Dr. Guinness has been monitoring Melvin's oxygen levels.
Right then, Melvin, there's no punctured lung I can see on your x-ray. You certainly have got big lungs, as you told me. Long lungs. I like that phrase.
I've got a big heart, apparently.
The Barnsley people are fab. Yeah, they are a very stoical bunch. You quite often only meet them towards, a fairly dire stage of their illness. I think that's the Yorkshire grit.
Melvin, are you wanting a sandwich? And a cup of tea?
Oh, yeah.
Is there anything you don't like on your sandwich? You've got ham, cheese, tuna mayonnaise, chicken mayonnaise. Ham. Melvin, we've got no ham sandwiches, I'm afraid. We've only got tuna mayonnaise. Is that all right?
It'll have to be with tuna mayonnaise. Christ.
It's all right, tuna.
I'll drink milk first. Thank you very much.
You're all right. Right, short, I'm going to get your oxygen mask and put your nasal cannula on.
Lots of the elderly patients we meet say that they feel lonely. And I think that's a really hard place to be. And when they come into hospital, there's lots of noise, there's lots of action, there's people to chat to. I think that can be very reassuring. And especially when you're unwell, being in that kind of environment where there's lots of people around can be a very positive thing, actually, in terms of people getting better.
Straight out at bloody ice box, these. Bloody frozen.
Eat that nice and quick for me, Melvin. I want to get you back on your liver. Do you want a break?
Yeah. I've been like this now for months on end.
All right. You just take that nice and steady, that breathing.
I live on my own.
Do you?
And since I've been in and my breathing's picked up a bit, I've been talking my head off. And I love.
No, that's all right.
That's living on my own.
Melvin's breathing is now stable, so he can be transferred to a ward to be treated by the respiratory team.
It does feel good, I won't lie, when someone is really unwell, and often just with some quite simple things that we do, they can be feeling so much better, and that feels good. I would say most of us are in the job because we enjoy making people feel better.
Melvin was discharged a week later. Arriving by ambulance is a man who's struggling to breathe. Paramedics bring him straight to resus.
1, 2, 3. There we go.
68-year-old Ray already suffers from cancer.
Last 2 hours, about a bit of difficulty in breathing in bed. He has been in quite a bit of pain with his back.
Dr. Kay has come to assess him.
Hello, sir.
Hello.
What's your name? Nice to meet you. My name's George. I'm one of the doctors. Who are these lovely people you've got with you? Stepdaughter. Nice to meet you all. What's brought you to see us today?
I couldn't get my breath.
He's not been well for a while. He's got a water infection.
Okay.
And he's just got worse.
Fine. And apart from your prostate cancer, do you have any other medical problems at all, sir?
Diabetes.
Yeah.
He's got a bit of cancer on his third and fourth rib, and he's got a bit of cancer at the bottom of his spine as well.
Okay. So we'll have a little listen to this chest of yours, have a quick feel of this tummy, and then we'll go from there, okay? And then just take some nice deep breaths in and out. And out. And again. And out. And again. Any pains in your tummy at all? Down below. I think there's a couple of possibilities really. Looking at your numbers and things, it does sound like you've got a bit of an infection going on because your temperature was quite high. Obviously we know you've got a water infection. I think we should probably give you some antibiotics through this drip which we've got in, okay? And certainly we're going to keep you in hospital. Okay.
What, just overnight?
So you'll probably be with us for a few days, I would imagine.
We're supposed to be going to Cyprus on
Oh
Friday.
dear.
Granddaughter's wedding.
How long's it been planned for, the wedding?
18 months. 18 months, 2 years.
At least once a week, I'd say, I get someone who's like, I'm doing this tomorrow or the next day, and am I going to make it?
Well, we hope it can go, but I don't know.
Obviously, we'll do our best. And I know it's a big thing that you don't want to miss, but we've also got to think about you, haven't we? If they're unwell and they need to come to hospital, then everyone's health should really trump everything. But obviously it's very difficult. The more concerning thing for me at the moment is your breathing. Because you're breathing quite quickly and actually you're on quite a lot of oxygen. We'll get you some antibiotics and see you again after you've had your x-rays and see where we go from there. Okay.
In Resus Bay 2 is 74-year-old Michael, who's struggling to breathe. Nurse Cheryl is assessing him.
So tell me from the beginning then. So you've had some shortness of breath and this cough that you've been up all night with.
Michael's joined by his wife Lorna and daughter Donella.
Let's have a little listen to your chest. Big breaths in and out for me then.
It's not one to say, can you phone the doctor or...
No.
I knew then when he said phone doctor that you weren't something not right. He never moans. Never moans. Never says he's poorly.
Well, you're really crackly. Just going to listen to your heart as well, okay? Okay. Right, we're going to get you some antibiotics. Treat things early, okay? You want to make sure there's no infection there. I'm going to get a chest x-ray. Sounds like you've got crackles on both sides. I know you probably normally have, but it sounds worse to me.
In Resus Bay 4, Ray's also struggling with breathing problems. He's come in with his partner Shirley and stepdaughter Sandra. It's just 2 days until his granddaughter's wedding in Cyprus.
But she's been busy for the last few days with wedding arrangements and then getting packed up and sorting bridesmaid dresses out, whatever. Yeah, it has been a nightmare. We'll get him there. Hopefully.
Dr. K is assessing his x-ray.
So there's a little bit of fluid there, but there's no big area of infection that I can see or anything like that. Oh. Look at that, you behaved. And I didn't even make a mess. Can you believe it, Chloe?
What?
Didn't make a mess.
I don't believe it.
So your x-ray looks okay, and there's no big area of pneumonia that I can see, so it is probably just more likely the water infection which has then tipped your breathing over the edge. So we'll need to keep you in to give you some antibiotics through this drip, and then see how we go. You're probably going to ask me how long, because I know you've got to go on Friday, haven't you? So we normally keep people in until the temperatures are under control, and obviously we're able to wean that oxygen off. Realistically, it's probably going to be a couple of days rather than just overnight. So I can't make any promises about Friday. I know it'll be a lot nicer to be in sunny Cyprus than being stuck in cloudy England, hey? Hopefully we can get you there.
I hope so.
Thank you.
All right, you're welcome.
Ray's staying in Resus. His temperature and oxygen dependence need to drop if he stands a chance of making the trip. Nurse Cheryl is assessing Michael for his breathing difficulties.
Struggle.
Yeah.
Tell her to walk windy.
Yeah.
Get some
Yeah.
air.
Just feel like you can't get enough air. Yeah.
And then shut windy because it's too cold.
Yeah. Okay, let's give you some more oxygen as well. So what did you do for a job?
Hey?
What was your job? What's your job? What was
Miner.
You're a miner. Where at? All right. So my dad was at Gorba and then went to Woolley. I remember going to pick his wages up with him when I was a little girl. There are lots of men that have worked down mines for many years that now are struggling with their breathing, and it's quite difficult to watch that, especially when your dad's a miner or was a miner and your family were before him. Hello, could I have a chest x-ray please for Michael? Yes, he's in B. Yeah, thanks then, bye-bye.
It's been 2 hours since Ray was admitted to Casualty with breathing difficulties.
We'll look after him.
There's no we can do now,
Yeah.
is there?
With the family wedding in Cyprus just 48 hours away, his stepdaughter and partner head home for some rest.
See you later.
Staff nurse Chloe Wesley is monitoring his progress.
You stuck with me now, love. I just got a thank you. Can you believe it?
It's nice, isn't it, when you do
It is.
It happens surprisingly little, doesn't it?
Yeah.
And then sometimes like a little thank you is just all you need, like
Yeah.
your little pick me up.
You think, all right, I'm doing something right. How are we feeling? Yeah? You can't get lost and wander off now.
Is that right?
Yep, like a tag. Are you from Barnsley then?
Yeah.
Yeah. Been here all your life?
Yeah.
You poor soul.
Why? I went on with Barnsley.
You used to work in pit?
Yeah.
How many years did you do that?
I already a couple. Do we end up seeing enough?
I don't blame you.
Ray's condition remains serious. He's a way off making the speedy recovery he needs.
So, we're going to get you up to ward. Bed's ready, and then you'll get seen by a doctor upstairs, okay?
Sounds good to me.
And then your good lady should come and see you tomorrow. Operation clean up after doctor. I'll let him off because it's George. Hey up, love, I've got a transfer from resource, please. Cheers. Bye.
Ray was transferred to the hospital's acute medical unit, where he stayed for 10 days.
See you later, darling. All the best.
He was unable to make it to the wedding in Cyprus, but he attended a UK celebration a few weeks later. Another former miner, Michael, is having a chest x-ray. Heading his way is volunteer Jane, who's helping out with a tea round.
Hello, love.
Oh, all right.
Well, we're bearing up a bit better state than what you're in at the minute, aren't we?
We'll have to get through, won't we?
I said, these things, you'll come to visit us on a Wednesday morning. I don't know. You've got naught better to do?
Yeah.
So how many grandkids have you got?
2.
2. What are they
I
called?
don't want them more.
No, do you?
Can't afford it.
Very expensive, isn't it, his grandkids?
His granddaughters absolutely love him to bits just because he's daft. He loves them to bits as well.
Their fingers can work faster than mine have ever done in my life.
Yeah. Yeah, but you do know that in a few years' time they'll probably end up getting arthritis in the fingers because they've worked that fast. And then putting a claim in. Laughter does help. I do think it helps in some respects, along with medicine. We'll get medicine their due, obviously. But I think humour is a big part of healing. You say it's quite warm now, don't you, love?
Somebody up near me.
Somebody hot near you. Well, what can I do? I'm red hot, aren't I? I'll see you later,
All right,
sweetheart.
Bob.
All right, darling. See you later. Do you want a cup of tea? Do you want a cuppa? Yeah. 2 teas?
Changing you again. Sorry.
Not that hungry. Well, in your face.
No, I'm just trying to get this off.
You see your head?
Mine's better than the others.
Straighten this out.
You wouldn't have been doing this at 5, 6 o'clock this morning.
Not like a bit of banter, is there?
No.
Are you allergic to anything?
Women.
Women.
Oh,
Yeah, my cherub.
Thank you.
So what's it like living with him then?
A nightmare.
A And how long have you been married?
53 years.
53 years?
Set him up.
Nurse Cheryl is comparing Michael's X-ray to a previous image.
So you can see his underlining problems with his chest. He's got all this nasty fibrosis to his lung fields.
The X-ray reveals that Michael has pneumonia, an infection in his lung tissue.
This doesn't look good though, does it? Okay, your numbers are a bit better anyway, aren't they now? That's good. So basically, we've done the X-ray, which showed that Michael's got a right-sided pneumonia, okay, on top of his normal respiratory problems, is why for the last 6 days you've really started to struggle. Obviously, you're coming in today, you know that, don't you? Yeah, I know that's obvious, but I like to tell you as well. We'll just keep monitoring him, see how it goes. Okay.
Yeah.
I know you're not bothered.
Will this...
Just explain.
right.
Of course you do, of course you do.
Pneumonia.
Yeah. Pneumonia is infection in one area of the lung field, yeah. Yeah, with the antibiotics is what we need, yeah. All right, no problem.
Michael is transferred to a ward for further treatment. It would be 2 weeks before he went home. The paramedics have briefed Nurse Cheryl about the patient.
So 3-day history of worsening chest symptoms. She's tripoding, she's holding herself like this, because her breathing's so bad. When that red phone rings, it gives you a bit of an adrenaline rush. I don't think that's a bad thing. It just makes your mind really switch on to what you're going to do. What's this lady's name?
Adele.
Adele? I'm Cheryl, I'm going to be looking after you, okay?
Take that off. Get your hands a little bit.
We'll sort you out, sweetheart. You just relax, okay?
I can't relax. I know you can.
1, 2, 3.
Oh, there you are, Adele.
Just sit you up.
Yeah.
Lovely. So what's been happening, Adele?
Just be breathing.
Yeah?
Thought it was panic attacks.
Yeah, well, it makes you feel that way, doesn't it?
Yeah.
Yeah. Okay, no problem. I'm going to get a full set of observations on you, okay?
Yeah.
When you see somebody with a short of breath, there's a bit of panic there, and that can go downhill really quickly. That's quite scary to treat, and I still find that a little bit daunting. All right, we've got a lining, haven't we? Let's get some 12 lead, let's get some bloods. Just take your time and I'll do an ABG as well.
Paramedic Michaela hands over.
He's currently on amoxicillin, finishes the course tomorrow. Gave her a Ventolin because they thought that she might be starting with something, but not really any lung condition at all. You didn't like to bother us, did you, Adele?
I didn't know, well.
You've had a bit of a time then, love, haven't you?
I have, love. Michaela says I should have phoned earlier.
You probably should, but if you think you're panicking, you don't, do you?
No.
All right, I'm just going to do a blood gas, all right, in your wrist.
Nurse Cheryl takes arterial blood to see if Adele's vital organs are getting enough oxygen.
We'll get all this breathing sorted for you, all right?
For that. Driving me nuts.
Bless you.
Oh.
Right, this is a bit sharp in your wrist, all right?
Yeah,
All right, just keep
whatever.
nice and still for me.
Oh, God.
It's all right.
Oh.
It's all right, you're doing brilliant.
Yeah. Just get on with it.
We've got it now, nice and still. Well done.
Adele's been struggling to breathe for over 9 hours.
God almighty.
Nurse Cheryl needs to find out the cause of the problem quickly. Sister Jane might need to request a bed on intensive care for 59-year-old Adele. Nurse Cheryl is still struggling to stabilise her breathing in resus.
Can you get me another gas needle, please? It's really massively important for us to keep calm. Now, inside we might not be calm, but on the external, we need to be calm. What I want you to do now, look at me, Adele. I'll just sit back.
Yeah. Oh.
Right. I always think about that swan, you know, looks really elegant on the lake, swimming very elegantly, but underneath the legs are going like lightning. And sometimes we're like that.
Oh.
Right, okay, you're safe now, okay?
The doctor's
I know it will be with the breathing.
Yeah.
All right.
Yeah.
All right. Nice and relaxed for me now. Some nice long breaths.
It's all right, you say
I
that.
know it is. I know it is.
Doing it all day.
I know. Shh, listen.
Yeah.
Just calm your breathing a bit.
I know.
Paramedic Michaela brought Adele in.
We're not going yet, are you, Michaela?
I will be in a minute.
All right.
Oh.
I know.
As much as I'd love to stay with you for a day.
You've got me now. I'm not looking after you.
She's been up with me and him.
Hold on.
Go.
Come on, don't get upset, you'll get worse.
I don't cry.
I know.
Sometimes when the patients come into resus, they've already formed that really good bond with that paramedic. And so that's massively important to make sure that the patient's aware that they've got to go, but that you're there for them now and that you're going to take over and you're going to look after them.
Adele has been given steroids and a nebulizer to try to improve her lung function.
Okay, so you've got widespread wheezing across your chest, all right? That's your upper airways, so we're giving you the right things. We just need to get the gas that we've done, and we'll get you some bloods off now. It's all right, you don't have to be sorry, sweetheart.
Adele's medical history gives cause for concern.
I had pneumonia when I was about 19.
Right.
I had that bad.
Yeah. We need to make sure you haven't got that again.
Adele needs an X-ray on her lungs, but she's too poorly to move.
Oh.
The machine must come to her.
It'll soon be done.
Back in resus, Adele is still struggling to breathe. Nurse Cheryl has arranged an X-ray to check for pneumonia.
We'll shout you to breathe in and hold your breath.
Don't let me laugh. What, no, breathe in and hold it?
I'll tell you where. Don't worry. And breathe normally. Reach your left side. That's a rib into.
Yeah, I'm fine with that. That looks all right?
Does it?
Yeah.
Oh, yeah.
Let's take this mask off now and see where we're at. Nice breathing for me now.
I'll try.
I know.
Like I've been doing that breathing all night.
Yeah, you get into a routine then, don't you?
Yeah.
There may be no sign of pneumonia, but there is an infection, which needs treating urgently.
So this is your antibiotic, because we've seen that little bit of infection on the bottom of the right lung. We think anyway we have. We'll see what the report says. It's not massive, but it's certainly there.
No, well, that's it, isn't it, love?
Yeah, that's it, love. Yeah, this will help. Let's get that back on board, because you were doing really well.
Yeah, love.
All right, so that's the antibiotics in your bloodstream, so that's sorted.
Cheers, all right, love.
Adele's daughter Katie has just found out what's happened.
Here she is. She's loads better than she was.
What are you doing?
I know.
On the bottom of your mum's right lung, there's a little tiny bit of infection there, but that can account for a lot of the shortness of breath she's had. Okay.
And panic attack.
Yes, definitely that. Well, there is an element of that, definitely.
Yeah.
But your chest was extremely wheezy, and that's why the salbutamol worked, because it helps with wheeziness.
Yeah. I thought I was going to die. Scary. Or pass out and knock back up.
Adele's son Michael arrives.
Oh, I am here.
Katie recently got married, and she hopes looking at the photos together will help calm her mum.
That's not a dress, obviously. That's a nice one.
Just breathe and sure. So I got your bloods back, and they're not bad at all, right? Okay. So I don't think it's a massive infection, this.
Good, love.
But we've covered it anyway, haven't we? We've given you some antibiotics, so that's fine. But you're still requiring oxygen, so that brings you into hospital. Okay. Other than that, you're doing fine.
Good. So, there's no untowards then, love?
No, nothing I can see. Yeah, all right.
Yeah. So what will happen to me now, then?
You go up to the ward, and they'll watch you for a while and try and get you off oxygen, and then decide what's going on then. Okay.
Oh, yeah.
On the ward, Adele's breathing improved further. She was well enough to go home the next day. Susan's oxygen saturations are very low, and if not quickly addressed, it could affect her heart and brain.
What's happened this morning?
I went kicking.
Yeah.
I fell.
And you fell? Mm. What happened? Do you remember falling?
Not really, no.
Not really. And tell me about your breathing. What's been going on this last couple of days? Is it worse than usual? Yeah. It is.
You have to think about what's ultimately going to affect the patient the most and what's going to put their life at risk. It's very unlikely that you're going to die from a broken wrist, but unfortunately breathing problems can be that severe.
So, Susan, what we need to do is we're going to get some bloods off you, give you some antibiotics and some nebulizers to help with your breathing.
Susan also has COPD, a progressive lung disease, so Dr. Lee needs to test her lung function.
The breathing's the main concern at the moment. Obviously, breathing and airway is the thing that's going to make you most unwell the most quickly.
Susan's fracture will have to wait to be treated, because the next hour is critical. If her breathing doesn't improve, her life is in danger. Resus is full. In Bay 2 is Susan. She's lived with the lung condition COPD for a long time. But now, she's struggling to breathe.
Susan, I've got some antibiotic to give you if that's okay.
Nurse Georgia and Dr. Lee are treating her. An X-ray has been ordered to assess Susan's lungs.
Susan, my name's Becky. We're just going to do a chest X-ray, okay, sweetheart?
The hope is it might shed some light on why her oxygen levels are so poor.
Okay, Susan, keep that chin up. Big breath in. Try and hold it. Well done.
Maybe something at the left base. So, quite congested all over. It looks like there might be a patch of something down in her left base. It could be the infection. It certainly looks like there's something on there, so we'll see what a blood test show and go from there.
With the X-ray showing signs of infection, Susan's blood tests also don't make for good reading.
Just a little bit acidotic, retaining quite a lot of CO2. So the worrying thing, if you look at the gases compared to the first one we took, is that despite all the treatment we've managed to give her, she seems to be getting worse rather than better.
Susan, do you know where you are? Where are you? Can you squeeze this hand for me?
Susan's been struggling with a lung condition for years, but now she's deteriorating. Dr. Lee rings her husband.
Hello, is that Russell? Hello, Russell. My name's Tom. I'm one of the doctors from Barnsley A&E. I'm just looking after your wife, Susan. Delivering bad news is never an easy thing to do. And I think the most important thing for me is to just try and imagine if I was that relative or that patient in that situation, how would I want that news to be broken to me? Unfortunately, due to how unwell she is at the moment and how, you know, she's been smoking for a long time and unfortunately done quite a lot of damage to her lungs. I'm not sure that in the event that her heart or lungs did stop working, I'm not sure we would be able to resuscitate her even if we tried. It's never an easy thing to get right. I think you just got to try and empathise as much as you can in that situation. This would only be in the event that her heart and lungs stopped working. Obviously, we're still going to keep treating her. Does that make sense, Russell? Okay. I'm sorry, Russell, that's a really rubbish conversation to have with someone over the phone. Okay, no problem. All the best. Bye.
The team will now monitor Susan closely, hoping she starts to respond to treatment. There are no free beds in Resus, where Dr. Lee is treating Susan. She's still struggling to breathe.
You seem a bit drowsy. Is that normal for you? Can I shine this light in your eyes? Open them up for me, nice and wide.
Susan's condition is deteriorating fast, so Registrar Dr. Dan Buick is brought onto her case.
She's a lady who has had an unwitnessed fall at home this morning. She can't remember it. She's also been feeling generally unwell for the last couple of days, more short of breath, productive cough. Sats were initially very low with Yaz, about 78%.
Is that air-driven or is that...?
That's air-driven, I think. George has just changed it.
She's getting there. Yeah. I'll sort out the bed. Thank you. Cheers, bro.
The decision is made to move Susan to another area of Resus, where they have specialist breathing equipment, which will hopefully stabilise her.
The blood tests have gotten a bit worse than we would have liked. Things don't look like they were going quite the way we'd hoped. So we'll move her to our other resus and try non-invasive ventilation, see if that can help improve her oxygen levels. But I think the next sort of 12 to 24 hours will probably be the critical time to see how well she picks up.
It's slightly tacky. How fast do you want this fluid?
I'm not too worried about pouring it in. It'll just help her keep chugging on. Thanks, mate.
Sister Bonita has fitted a mask for Susan that will increase the oxygen into her body and help her to breathe out more carbon dioxide, relieving the pressure on her lungs.
Right, I'm going to lay you down for 2 minutes, pull you up, you can hate me. 2 minutes, I know, 2 minutes, let go.
At the moment, we are a little bit out of tricks. It is one of those situations where we might not get the result that we want, but she is responding to the treatment that we're giving her, which is encouraging. So, as I say, I'd hope she would pick up.
Over the next day, Susan did manage to stabilise and was transferred to the hospital's respiratory ward, where she remained for 6 weeks before being discharged. Paramedics have rushed in 85-year-old Margaret. They've given her steroids, but she's still struggling to breathe.
Hold on tight. You have to right if you like. 4, 3, 2, 1, go!
Right, this is Margaret. Margaret is 85 years old. Last 3 or 4 days had increased shortness of breath with a productive cough, Respiratory. She's a smoker. When she's walking, she has really short breath.
Okay.
Speaking sentences.
Perfect, thank you very much.
I'm more commonly known as Pearl.
Do you prefer to be called Pearl then?
Yeah.
Is Margaret your Sunday name if you've done something wrong?
That's my real name,
Yeah.
Margaret, but everybody calls me Pearl. It means, Margaret means something pure. Pearl.
Oh.
You didn't know that, did you?
I didn't. But what we're going to do is we're just going to hook you up onto our monitor, do your blood pressure and everything, okay?
Okay.
And then we're going to have a little look at you and then try and get you feeling a bit better and get some blood tests done. Is that all right?
Yeah, some stickers are right, sweetheart.
I think the whole bedside manner and things helps throughout everything. And we don't have long to do that, we only have a few minutes. And it just helps them trust you a bit more. So how long have you been poorly for? Is it just the
About
last
4 days.
And do you normally have much of a cough, or is that?
Yeah, I've always had a smoker's cough.
And what made you phone for the ambulance today?
Because I knew there was something not quite right.
Was it because your breathing was just getting that much worse?
I was so weak.
Yeah.
Yeah, that was the main thing. I couldn't do what I wanted to do.
Okay. And who do you live with at home normally?
The cat.
Anyone else?
He's bloody useless.
Oh, I wouldn't go that. I'm sure he gives you good company, doesn't he?
Well, yeah.
And how many do you smoke?
Well, I've cut down a lot. I reckon about 8 a day. But these last few days, been virtually nil.
And how long have you smoked for? Since you were a teen?
Not doing it.
And how many years young are you now?
85 years young.
So probably about 70 years you've spoken for?
No, because I was an athlete at one time.
Oh.
What did you used to do? A sprinter.
Sprinter?
I better be careful I don't annoy you and then you'll be chasing down the corridor then, I don't know.
To get to the bottom of what's caused Pearl's breathing difficulties, she's going to need more tests. Her condition could turn out to be serious.
Right, can I have a little listen to your chest and things? Is that all right?
Feel free.
Treating her are Dr. Kay and Nurse Kim Gibson.
I'm just going to borrow your hands first of all. I'm just going to have a quick feed of your pulses. Your heart's racing a little bit, isn't it?
I don't feel as breathless.
That's good. Right then, should we get some bloods off you?
Yeah. I have much to give.
I need to get your chest area, is that alright?
What the bloody hell?
Oh, it's all my bits and bobs.
Spaghetti junction here.
Wires all over.
Hey, and what would we do without you?
That's it.
And we grumble about the health service, but
What would we do without her?
So I'm just going to borrow this little vein here, if that's okay.
Don't worry, I'm not going to get you.
no, there's not much to see.
Sound like mine, Anne?
I'm only a shadow of the person I used to be. Hey, you're laughing.
That's what my Anne said, yeah.
I used to miss out door girl at Pontins.
Did you?
Yeah.
So, listening to your chest, and with you having the cough that you have, I think you've got a chest infection or a pneumonia.
I understand.
I've done some special blood tests here to see if we get any bugs that grow in your blood. Okay.
Better not be.
Well, exactly. So we're going to give you some antibiotics and some fluids now. You're obviously needing a bit of oxygen, and we'll get an X-ray of your chest while you're in here as well. You'll be staying in hospital today, I'm afraid. You'll probably be with us for a few days.
Oh, no.
I know.
No.
But we need to get you sorted, don't we?
What about my cat? Homer.
I'm afraid we need to look after you, don't we? Because if we don't look after you, you'll not be in a position. You won't be able to look after Homer either, will you?
No.
So we need to get you sorted.
Yeah, I understand.
You want, love? Do you want a cup of tea, Margaret?
I love one. And a bag.
Well, listen, I can't offer you that at the moment. Do you want milk, sugar?
2 sugars, please, and milk. And then can I phone my daughter?
You can phone your daughter now if you like.
Right.
Yeah, you can use phones, that's fine.
I'm in hospital. Have you fed the cat? What do you mean, sod the cat? Okie dokie. Yeah, ta-ra. She's on her way, so they're all on the way. They're being invaded. Aliens.
Pearl may be making light of things, but Dr. K wants to get her breathing and heart rate under control. She's not out of danger yet.
Not easy, this. It's a whiskey in it.
To find out what's causing 85-year-old Pearl's breathing problems, she needs a chest X-ray.
I'll leave you with X-ray, all right?
But because she's so poorly, they are coming to her.
So, you've no bra on, have you, sweetheart?
No, I've got no to put in it.
Neither have I, don't worry. I'm going to sit you forwards a bit, all right?
Yep.
So, in a minute, all I need you to do is take a deep breath and hold it, all right? Breathe in for me. Hold your breath. Breathe normally, darling. Lovely.
Can I go home now? How long do I have to do these on?
Just because you're being quite poorly, so just need to keep an eye on you, all right?
Come on in and enjoy the bloody show. What are you here for?
I'll leave you with it. All right.
So who are these gentlemen you've got with you?
That's my son, Robert.
Yep.
Mr. Son, Kenneth.
Fine, nice to meet you both. My name's George, I'm one of the A&E doctors, all right. So I was just coming back to speak to you about your blood tests and your X-ray, if that's okay. So your blood tests show you've got an infection.
Right.
We knew that anyway. Okay. Your X-ray shows you probably do have a patch of infection on this right-hand side where your crackles were.
Something untoward there.
Chest infection and pneumonia are the same thing. One we just see on an X-ray and one we don't. So the treatment's the same. I know.
Treated the same.
Yeah.
Antibiotics.
So we just need to get you up onto the ward. As a general rule,
yeah, it's safer to be in overnight.
So you need to stay in because your heart's still racing and you're needing oxygen. So I can't let you go home if you're needing oxygen.
She's obviously told you she's a smoker.
Yes, yeah.
I'm surprised that the doctor hasn't told you. At your age, you should know better.
I've already done that. Yeah.
Yeah.
We've already told you off, haven't we?
Yeah. It's not about quantity of life, it's about quality, isn't it? Is it?
Smoking affects the quality of life.
Well, yeah, that's true. You don't want to be in here every month, do you?
Eventually, the quantity as well.
No.
Because that's what we see with a lot of people that have been smoking all their life. They're in kind of every 2, 3, 4 weeks. And I would argue that probably isn't a good quality of life. But got an infection. Yes, we know you have pneumonia. But actually, you're looking better than when you first came in, which is good.
Okay. I'll feel a bit better.
Good.
I felt terrible.
After 10 days on a ward, Pearl was well enough to go home and was reunited with her much-loved Moggy, Homer.
Barnsley ED. Yeah, is it medical or trauma?
Dr. Humphrey has called to resus to assess 76-year-old Cynthia, who is struggling to breathe.
You were a little bit blue when you got here, I think. I don't think there's any worse symptom for a patient than actually feeling like you're gasping your last breath. Their brain's not working, the rest of the body's crying out for oxygen, And they become very sick very quickly unless you do something about it. Right, I'm Dr. Humphrey. You're Cynthia's other half. I was right, OK. And you brought her up with a bad chest.
Very bad chest.
OK. Now, do you not...
COPD for about 20 years.
Right, OK. So you've had a bad chest for about 20 years?
Yes, I stopped smoking 20 years ago.
Right. Now, how far can you walk normally without getting breathless before you became unwell?
Probably 50 years because I have vascular disease as well.
Right,
I've
OK.
had 9 operations on my legs. I can only get from the bedroom to the bathroom and then I'm out of puff.
Right,
This
OK.
week.
That's this week. So your exercise tolerance has gone right down, hasn't it? You can't even walk within your house without getting breathless. So have you had any problems with your heart attacks or angina?
I have angina.
Right, but never a heart attack?
Never. Not that
OK.
I know.
We'll need to take some blood from you and send you for a chest x-ray and
Mhm.
things. Let's have a little look at you then. Just sit yourself forward. Let's have a listen to your back. Mine's a bit cold, I'm afraid. Yeah, it's not sounding very nice in there, very crackly. So what were you doing when you were working?
Mainly office work. Before we got married, I worked in a paint spraying place, which I shouldn't have done.
Right.
Because it were chemicals, but we needed the money to get married. So, it's what you did.
Is this the first time that you've had a nasty infection in your chest that hasn't gone away with antibiotics?
Yes.
They did a heart tracing, didn't they, earlier on? OK. Yeah, you've not got a lot of oxygen going around in your blood. Let me just get these blood tests sent off and we'll get you started on some medicines, all right?
In Rhesus Bay 3, Dr. Humphrey is still trying to get to the root of why Cynthia is so short of breath.
So you've had a reaction to doxycycline in the past, according to your GP notes?
Yes.
And ampicillin and erythromycin. Your GP sent a sample of your spit to the lab, is that right?
Yes, I took it down on Wednesday.
Right, let's see if that's come back then. She's sensitive to several antibiotics. We know that amoxicillin's clearly not working, so we need to give her perhaps something slightly different. I've just checked and she's grown Haemophilus influenza in her sputum.
Right, okay.
From the sample that was sent by a GP, and it's resistant to amoxicillin.
Right,
So that is why she's not got better. Right, the sample of spit that was sent to the lab by your family doctor grew a bug which has got a fancy name called Haemophilus influenza, and it fights off amoxicillin. So now we know that you're on the wrong antibiotic. We can get you started on the right one.
Oh, good.
Okay. The reason you're in here is because when we've checked your blood pressure and your pulse and how much oxygen you've got in your blood, it's not very. It's your physiology is not good.
Well, I'm not going anywhere, just yet.
No. I think you just need to take it easy and let us get on top of this infection for you. Okay. I think you're going to need to be in hospital for a few days. Antibiotics. Coimoxiclav and clarithromycin. Hello, it's Julian Humphrey round in Rhesus. Can we have a portable chest x-ray on a lady called Cynthia Megginson? OK, thank you. Bye. Once that diagnosis, that scan is done and you see the result and the report comes back, you think, I've done it, yes, OK. Now the patient can get the treatment that they need. You've got some changes at the bottom of your lung on your x-ray that suggest that you've got a pneumonia on the left-hand side at the bottom.
Right.
And probably a little bit on the right-hand side, all right? So it should, once you're on the right antibiotics, that should start to clear up fairly quickly, all right?
That's fine.
So I'm sure you'll be feeling a lot better within a couple of days. All right. Anyway, she's getting better, isn't she?
She is.
Looking happier.
Hello, Barnsley. Yeah. So we've got a 52-year-old male, end-stage COPD, in respiratory failure. What's your ETA, please? 10 minutes. Thank you. You can fetch him straight into resus. We'll see you there.
Come on, Dr. Humphreys, it's me and Lee.
Leading today's resuscitation team is Dr. Julian Humphrey.
Are you going to be all right with no glasses on?
I've got my contact lenses in now. Unfortunately, I can see.
cheeky or?
We feed off each other, I think, in terms of the comical element of what we do, and we don't take our job too seriously. I think that's probably what it is. But when we have to, you know, we're on the ball.
Paramedics bring 52-year-old Andrew straight to resus.
Hello, young man.
Andrew, I'm just going to get you onto this trolley. You're in the hospital.
Can you shuffle across?
Yeah, ready, slide.
I'm Benita, sweetheart. I'm just going to hook you up to a load of machines, alright? Are we alright to get to your chest?
Yeah.
You're just going to take some
I
blood
want to
off.
have a little listen to your chest, all right, while we put all of these bits and pieces on, okay?
You feel like you're struggling?
Community matron's come out today. It's just a routine visit that she's come out for. Basically, she's found him outside of bed, increased stress rate, SATs on O2 at that time 60%.
Okay. Look at me, look at me. Right, I'm Dr. Humphrey, okay?
Yeah.
How long have you been like this?
Couple of days.
Right.
All right, bud.
Have you had any shivers, sweats?
Yeah.
And are you bringing anything off your chest?
Yeah, loads of stuff.
What colour?
Green.
No blood?
I have a little bit, yeah. I'm in a lot of pain.
Yes, I can try and get rid of that for you once I get a little tube in.
Yeah.
You were a minor, were you? How many years were you down the pit? 7 years, right, okay. I presume you were a smoker as well, were you?
I smoke.
It takes a lot to be a minor. To survive that and then be crippled by the effects of it, that's a very difficult situation to deal with. And that sometimes shows through in the strength of character that these patients have.
Basically, my lungs have it.
Right, okay. Basically, they're just saying that your lungs are packed up and there's nothing that they can do about it.
That's right, yeah.
Right, and in the end, your lungs will pack up and that'll be it, won't it?
That's exactly it.
Right, okay. So we're really struggling to get a line in you, and you say that normally go for your feet. Well, I can't really see anything there either. I'll try over here again.
Right, I'm going to go this side, is that you?
I think they're all shot.
Yeah.
Totally shot. Hi, it's Julian Humphrey, one of the emergency medicine consultants. I've got a little bit of an issue. I've got a gentleman who's come in, he's in his 50s, he has home oxygen. He sounds like he's sort of end stage COPD. So what I'm going to do is I'm going to give him a trial of non-invasive ventilation and see how he gets on. The other problem I've got with him is that I can't get any IV access. Yeah, all right, no problem, bye.
Right, sweetheart, I'm going to change this mask out.
It's not going to be warm, is it?
No, this one's a smaller one, alright. Let's have a go.
Are you alright with your cannula going in this arm? If we can get one in this arm.
I tend these days to try and imagine that that's my father sitting there, or my mother, or my sister. You don't block it out. You can't block it out. You mentally process it and then you come out the other side and you carry on. That's what you do. We're not aiming for a cure here. We're aiming for comfort and support.
You've done really well.
Thanking you.
We're done.
You've done very well. You can have a round of applause.
I'll leave you in peace now, Andrew.
Hello. Hiya, is that Adrian? Hiya, are you Andrew's brother?
I am, yeah.
Hiya, I'm Benita. I'm one of the sisters in from Barnsley A&E. I've got your brother with us in hospital at the moment. I was just ringing to let you know that he's not very well at the minute. Yeah, if you just come straight in, lovely, I'll keep my eye out for you. All right, bye-bye, bye-bye. He's on his way, love, maybe about half an hour, 40 minutes.
I do see patients that are about my age who are dying prematurely.
He's just been booked in.
It reminds me of my own mortality. That's what it does. It's not one that we like, but we have to face up to it. That's part of being a doctor.
Andrew has a chronic lung condition and is in the care of Sister Wainwright.
How are we doing? Pain-wise? Any better? Your oxygen levels are a lot better with that on. Right, sip of tea. Not many get a cup of tea, you know. And I've stirred it this time. You can, I'll get that.
Shocking.
Shocking? You said my cup of tea was shocking?
No, I said it's all right.
Oh, I said shocking.
I did. Look at that.
It's that good, you're missing your mouth.
I know.
You alright?
Yeah.
Yeah?
Not at the library.
We're going back home. Yeah?
I always say to students and those that work alongside me, just treat people like they are your loved ones, because I've been in that situation, I always think actually that one day you might be in that situation.
Andrew has now been in resus for 3.5 hours.
Right, pop your finger on here for me.
His brother Adrian has arrived.
So I'll give the MedReg a call and she can come down and have a word. Hiya, it's Benita down in Resus, just to let you know Andrew's brother's here. See you soon, bye-bye.
You're aching all over. Again, I'm going to do a bit. See what doctor says. Yeah, do I need to ring my sister?
Just a harrowing situation to be in, actually. To think that you're part of that man's care. It's really hard sometimes. It doesn't stop me doing my job, and I think it makes you a stronger person for being in those situations.
It's been almost 4 hours since 52-year-old Andrew was admitted to resus.
One last blood test. I feel like we've got some love-hate relationship going off me and you.
I think if I can try and make light of just the smallest bits, then that actually helps and relieves a lot of stress. And if you can't just do the slightest things that make that process easier, then why would I do my job?
Right, just relax this arm again for me. No, it's not as good this side.
Like playing darts, this.
Right, sharp job, sweetheart, I'm sorry. Hiya, sorry to bother you. It's Sister downstairs in ED Resus. I've got a chappie for you, Andrew Bella. Do you know about him? 52-year-old. Do you want me to hand him over to you? I think he's getting close to breach as we speak. It's end stages of COPD, this chappie. It's only young.
Andrew is moved to intensive care for further treatment. The team there will work to stabilise him before he'll be allowed to return home.
It's a massive honour to be there, and that sounds really weird, but you build up a rapport with the patient and the family, and if you can make them feel more secure that you're going to carry out the care the best you can, then that is a huge honour, yeah?
Hello, Barnsley A&E. Okay, so 48-year-old female. Okay, yeah, straight to resus, please.
Paramedics are rushing in another patient who's struggling to breathe. Registrar Dr. Rob Cornford and Nurse Millie Schumacher prepare Resus Bay 3.
Hello.
Arriving is 48-year-old Donna. Niece Sinead is by her side.
We're just going to come at you at all angles now, all right?
Just sit forward a tiny little bit for me, my love. I'm just going to have a quick listen to your chest and then we'll listen to what these ambulance people say.
This is Donna.
Yep.
Donna's had a fall around about a week ago. Didn't do anything about it, but has had some kind of rib pains and back pains since then. Has gradually got worse with her breathing over the kind of last week.
No pains in your stomach at all? Bit of pain in your tummy as well?
Yeah, just...
Or like lower ribs?
Just breathing.
Yeah, okay. And what happened with this fall? What happened exactly?
I got up from the kitchen to go and make myself tea. Next minute I'm on the floor.
You can often see people who have kind of put up and dealt with stuff for a few days before coming to A&E, whereas I think if I had the same problem, I'd probably be coming into hospital a little bit sooner. They seem to be quite tough and not people to complain very much. All right, sharp coming up now.
Paramedics recorded Donna's oxygen levels as dangerously low.
This one come off as well, yeah?
An arterial blood sample should show if there's been any improvement.
So what we'll do next is we'll give you these nebulizers, we'll give you some steroids as well.
But Donna is still struggling. The first step in understanding just what's going on is an urgent X-ray. Dr. Cornford is concerned Donna may have a collapsed lung, which in severe cases can be life-threatening. Not able to go anywhere yet is 48-year-old Donna. She was rushed in by ambulance, struggling to breathe. Nurse Millie is administering medication through a nebulizer to open up Donna's airways.
Do you feel sick as well?
I do.
Yeah, and have you been vomiting as well as coughing stuff up?
No,
just coughing stuff up. But you feel sick as well? Yeah.
Dr. Cornford is concerned that Donna could have a collapsed lung, caused by a fall she had earlier in the week.
Okay.
So yeah, they're going to come round and get an X-ray of your chest in a minute, okay?
She's not stable enough to move, so the X-ray comes to her.
X-rays!
Can't see any broken ribs, obviously. Can't see any pneumothorax.
The X-ray is clear, but Dr. Cornford needs to take another arterial blood sample.
Can you turn your wrist round for me?
That way, isn't it?
Right. You've done that one before, haven't you?
I have, yeah.
Bless you.
Taking blood from an artery is the best way to check if Donna's oxygen levels have improved, but it can be painful.
Sharp now. Almost done. All right, hold on.
It's okay. It's to be done, doesn't it? Yeah.
So I think there's probably a bit of infection in your chest, probably as a result of this when you've fallen and banged your ribs. You've not been able to breathe properly and get a good breath in, which makes it you're more prone to getting an infection. And then reduce the amount of oxygen that you need, and then we'll get you up onto the ward. Probably be in hospital for a day or two, I would have thought, if everything goes well. Okay.
No, thank you.
You're welcome.
Donna was treated with antibiotics for a chest infection and was able to go home 10 days later. Paramedics are bringing in a 73-year-old man who's struggling to breathe. Registrar Dr. Rob Cornford will be taking the lead.
When the red phone rings, there's a combination of excitement, as in what's going to be coming in, sometimes a little bit nervous, so mixture of emotions.
Slide, ready, steady, slide. Oh, look at that.
Any urgent concerns?
Rapid desaturation, pyrexic, clearing sepsis,
Yep.
heart rate of 130, extensive cardiac history. He has got pulmonary fibrosis.
Okay. Nice to meet you, John. My name's Rob, I'm one of the doctors. Okay. Pulmonary fibrosis. Do they know what's caused it? Have you had an occupation that's damaged your lung? Industry, yeah.
This is working in heavy engineering.
Okay,
And
yeah.
it's all grinding
Yeah, yeah,
and galvanising.
yeah.
John's lungs have been permanently damaged,
Are you alright just to lean forwards a little bit for me?
but the paramedics were concerned he could have developed sepsis. Both conditions can be life-threatening.
Any pain anywhere at the moment?
Oh, it's just a bit tight.
A bit tight, okay,
Yeah.
fine. Alright. And are you coughing anything up today?
No, I just
And you've been having fevers and temperatures at home as well, I understand.
can't see it.
Yeah. I just want to have a quick feel of your tummy as well, if I may.
Yeah.
Have a gentle press. Not painful in your stomach at all. Not had any diarrhea, vomiting,
No.
problems with your waterworks.
I've been sick a couple of times.
Been sick a couple of times. Okay. You need your cigarettes?
Dr. Cornford orders an urgent X-ray and blood tests. He's concerned that John's lungs have deteriorated further and there could be other complications.
Hello, it's Rob Round in Resus. I've just put a chest X-ray on for a chappie in Resus 4.
As John is too poorly to go to radiology,
Put this hard board behind your back.
the portable X-ray comes to him.
Just breathe in, hold your breath.
John must wait for his results, but while he does, he's still struggling to breathe. In Resus, John is waiting to see if his lung condition has got worse and whether he has sepsis, which could be life-threatening. Wife Margaret is at his side. John's X-ray results are back. Assessing them is Dr. Cornford.
Yeah, so it looks like round here there's probably a bit of infection. So that suggests that there's probably some infection here, which is different to how it was not so long ago. How are you feeling, John?
I just had a coughing bout.
Yeah. So it looks like you've got a patch of infection on the left side of your chest, which has caused some inflammation. It's making it painful when you breathe in. We've given you some antibiotics, which should cover for that.
You've been thorough, haven't you?
I think we're going to get you around onto the acute medical unit.
The condition of John's lungs has deteriorated, and Dr. Cornford has been unable to rule out sepsis. He needs to be admitted to the acute medical unit for more tests.
It's okay. You'll definitely get seen by one of the medical doctors tonight, and then you'll be seen probably by the respiratory team in the morning tomorrow. All right.
Okay, thanks ever so much.
No worries.
Further tests revealed that John had pneumonia, not sepsis. After a week on the ward and antibiotic treatment, he was feeling much better and allowed home.